Hi guys, I'm Zaki, a Bachelor of Computer Science student at NT International University. Today, I'm going to talk about the recent data breach incident involving MedixSys Solutions. MedixSys Solutions is an ASP company based in Singapore. This company offers a cloud-based electronic health record (EHR) system called MedixSys, which is currently used by over 40 private clinics and specialty hospitals across Southeast Asia. MedixSys enables healthcare providers to securely manage patient records, automate appointment scheduling and billing, access real-time patient data from any authorized device, and generate prescriptions and lab orders digitally. One of their clients is Silvercare Clinic Group, a regional chain of elderly care clinics in Malaysia. Silvercare subscribes to MedixSys through a monthly per-user fee, with all their patient data, medical histories, and billing records are securely stored on MedixSys' cloud servers. However, in February 2025, MedixSys suffered a major cybersecurity breach caused by a zero-day vulnerability in an outdated third-party plugin used in their web application firewall. This vulnerability led to a data breach affecting their clients. Over 55,000 patient records from 17 clinics were compromised, including Silvercare clinics. The breach went undetected for 9 days, until attackers demanded a ransom in Bitcoin, after leaking sample data on the dark web. The purpose of this video is to examine the recent cybersecurity breach at MedixSys Solutions. What happened, the security weaknesses that led to the incident, and how organizations like MedixSys can strengthen their defenses to prevent similar incidents from happening in the future. Security in SaaS is not just a technical requirement, it is critical for protecting user trust and ensuring business continuity. But before we go further, what is ASP and what is SaaS? Some of you might be wondering what these terms mean. ASP stands for Application Service Provider, basically a company that delivers software applications to customers over the internet, typically on a subscription basis. And this model commonly known as Software as a Service, or SaaS. Instead of purchasing and installing software on local machines, users, especially businesses, can access these applications securely through cloud. MedixSys' MedixSys platform is a perfect example of this. They provide SME clinics like Silvercare with a complete electronic health record (EHR) system without need to maintain their own servers or IT infrastructure. This cloud-based software delivery model offers significant benefits. The clinics can save on costly hardware and avoid the expense of hiring specialized IT staff to manage it. Moreover, they can access patient records from any authorized device, automate appointments, and generate digital prescriptions. These aren't just conveniences, they improve business efficiency and enhance the patient experience. Now let's analyze the security threats and risks MedixSys faced during the incident. The primary threat was a data breach, where the attackers gained unauthorized administrative access through an outdated third-party plugin in the company's web application firewall. This vulnerability gave them access to over 55,000 patient records across 17 client clinics. The incident quickly escalated into a ransomware-like attack, as the attackers demanded payment in Bitcoin after leaking sample data on the dark web. Additionally, due to insufficient staff training and weak security governance, employees remained vulnerable to phishing attacks, thus putting user accounts and internal systems at further risk. Now, what made MedixSys so vulnerable? Several critical weaknesses were identified. First, weak security governance. The company had no formal Security Operations Center (SOC) and no Chief Information Security Officer (CISO). Without dedicated leadership and continuous monitoring, critical threats went undetected. Second, poor patch management. Known vulnerabilities in their systems remained unpatched for over 5 months, despite clear alerts from vendors. This gave attackers an easy entry point to exploit the system. Third, improper key management. While data was encrypted, the encryption keys were stored on the same server as the data itself, thus defeating the purpose of encryption. Best practice requires keys to be stored in a separate, secure key vault, ideally in an isolated environment. Fourth, lack of SIEM and intrusion detection systems. Without a security information and event management (SIEM) system or real-time intrusion detection, MedixSys had no way to detect suspicious activity. This significantly prolonged the attacker's activity remained undetected. And finally, unclear responsibilities in the SLA. Their service level agreement lacked clear terms on incident response timelines, data breach notification requirements, and liability clauses. This left clients like Silvercare with little contractual protection in the event of a breach. This incident affected multiple parties, each facing significant consequences. From MedixSys's perspective, the impact was great. The company suffered reputational damage after being labeled an unsafe health tech provider in the media. They also faced regulatory penalties, including a Rm 1.5 million fine under Malaysia's Personal Data Protection Act, PDPA. They lost 5 major clients and some paused, and some others completely cancelled their subscriptions. This directly impacting their revenue and long-term business sustainability. From the client's perspective, the impact was equally damaging. Affected clinics were forced to revert to manual record-keeping, leading to slower patient services, increased administrative errors, and a breakdown in operational efficiency. Above all, it was the patients who paid the highest price. Their private health data was exposed on the dark web. This breach of trust raises serious long-term privacy concerns, including risks of identity theft and medical fraud. To prevent incidents like this, organizations must implement strong security policies. These policies are important because they set formal guidelines that define how an organization protects its data, systems, and users. For MedixSys, security policies should have clearly addressed several critical areas. The first is data access control. Make sure that only authorized personnel can access patient records, based on role-based permissions and the principle of least privilege. Second is password and authentication protocols. Enforcing strong password policies and requiring multi-factor authentication, MFA, for all user accounts, especially administrative ones. Third is patch management. Establish a formal process to promptly update the systems and third-party components as soon as vulnerabilities are identified or vendor patches are released. And the last is incident response. Define a clear plan for how the company detects, responds to, and recovers from security incidents, including communication protocols, breach reporting, and coordination with clients and regulators. These security policies are based on the CIA triad of security, which is confidentiality, ensuring that patient data remains private and accessible only to authorized individuals. Integrity, guaranteeing that data is accurate, complete, and protected from unauthorized modification. And availability, making sure that systems and data are accessible to authorized users whenever needed, especially during critical healthcare operations. Together, these principles form the core of a robust security strategy. Aside from digital safeguards, physical security is also equally critical in protecting sensitive data. For MedixSys, this including securing their data centers with strict access controls, 24/7 surveillance, and biometric authentication for staff. Only authorized personnel should be able to enter sensitive areas. This will be reducing the risk of insider threats or physical tampering. Additionally, the infrastructure also must be protected against natural disasters, theft, and power outages. Key safeguards including backup generators, redundant storage systems, and comprehensive disaster recovery plans. All these ensure system availability and allow MedixSys to maintain uninterrupted service, even during emergencies. Alongside physical security measures, encryption also important for safeguarding sensitive information, especially patient records. Even if attackers manage to steal encrypted data, they won't be able to read it without the decryption keys. This makes encryption a critical last line of defense. However, in MedixSys's case, the encryption keys were stored on the same server as the encrypted data. This poor security practice effectively nullified the protection, making the encryption useless. The best practice is to separate encryption keys from the data by storing them in a dedicated, secure key vault. Additionally, organizations should rotate keys regularly and enforce strict access controls to further reduce the risk of compromise. Together, physical security and encryption create a strong layer of defense, protecting systems not only from cyber attacks but also from physical tampering, theft, and environmental threats. For the conclusion, the MedixSys breach shows us just how important information security is for application service providers, especially in sensitive industries like healthcare. This incident teaches us that cybersecurity threats are not just technical, they're also ethical as well. Fail to protect patient data doesn't just violate regulations, it erodes trust, disrupts critical services, and exposes organizations to severe consequences. To prevent such failures, organizations must adopt strong security policies, both physically and digitally, and implement encryption correctly, not as an option, but as a core design principle. Because in the digital age, security is not optional. It is the foundation of trust. That's all from me, thanks for watching.